Welcome to the No Nonsense Guide to Type 2 Diabetes. Type 2 is a complex disorder which alters the body's ability to deal with sugar. It mainly affects adults, but very occasionally it affects children. Over 2 million people in the UK are thought to have diabetes. Although there are several different types of diabetes, 7 out of 8 people have type 2 diabetes. You should, by the end of this programme, have a far better understanding of type 2 diabetes and its long-term consequences. We have 3 reporters with us, Sarah, Marianne and Angela, who will be bringing us the news and information from various parts of the country.
Coming up, diagnosis. What causes diabetes? Adopting a healthier lifestyle. Managing your diabetes. Monitoring and complications. But first, to give you a better understanding of type 2, we must take a look at how your body deals with food. The human body is very efficient at processing food. When you eat food, your body breaks it down into its component parts, and one of these components is glucose. Glucose, a type of sugar, is needed for energy. Your body usually controls the level of glucose in your blood very tightly, mostly keeping the concentration between 4 and 7 millimoles per litre. Insulin is a hormone produced by the pancreas in response to changes in blood glucose. Insulin lowers the blood glucose level by making the muscles, fat and your liver take up the glucose from the blood in order to use the sugar to produce energy. In certain circumstances, a situation called insulin resistance, the muscles, liver and fat do not respond to insulin as well as they should. When this happens, the body produces more insulin to lower the glucose. Eventually, the pancreas is unable to produce enough insulin to overcome the resistance, and blood glucose increases, sometimes despite high insulin levels. That is how this form of diabetes develops. When the pancreas cannot produce as much insulin as the body needs to keep the glucose controlled. Initially, patients with type 2 diabetes may have no symptoms, but as time passes, the patient may develop symptoms such as blurred vision, a need for frequent urination, as well as regularly feeling tired and thirsty. These symptoms should alert you or your doctor to the fact that you may have diabetes.
%50 of the Scottish population is overweight, and everyone, not just those with diabetes, would benefit from a healthy diet and more physical activity. Taking exercise and controlling your weight is the best thing you can do, not only to control your diabetes, but it'll also improve your chances of a healthier future. We sent Sarah to interview consultant Dr. Anne Gold, who has an interest in lifestyle management.
Thanks, Alison. We're here in Aberdeen to meet Dr. Anne Gold, who is a consultant in diabetes at the Aberdeen Royal Infirmary. Anne, what are the beneficial effects of exercise and healthy eating?
Well, I think first and foremost, people who take regular exercise and eat healthily feel better. They've got higher self-esteem, they're less depressed and generally feel much better about themselves. If we think about healthy eating for a start, and by healthy eating you mean a balanced diet. There's no treats that you can't have, it's just everything's in moderation. That if you eat healthily when previously you've not been eating a healthy diet, you might lose weight. But even if you don't lose weight, you can still benefit your diabetes. You can put less of a strain on the pancreas by allowing your own insulin to work more efficiently, and that improves your overall blood sugar control. If you alter the amount and the type of fat that you eat, that might also help you lose weight, can benefit your heart, and reducing your salt intake can lower your risk of high blood pressure in the future. Thinking about physical activity, as I said, that all the studies show that people who exercise regularly are less depressed and feel good. We often think that physical activity is there to help people lose weight, but even if you don't lose weight by exercising, it can benefit your diabetes. By taking regular exercise, you improve the way that your own insulin works, which reduces the strain on the pancreas, improves your overall blood sugar control. You lower your blood pressure by exercising regularly, and your risk of heart attacks in the future is greatly reduced.
Do you watch what you eat?
Yes, I do. I eat a lot of fruit, not big portions of anything sweet. Small portions if I'm out for dinner or something, I'll have a small portion. Other than that, I just watch what I'm eating and the sweet things.
Can you give any advice for someone who has just been diagnosed with diabetes?
First of all, don't panic and take which I must admit I did, and then take the advice that's given from the GP or in the diabetic clinic and try and change things that they want you to change. It's like just changing little things, but it could make a big difference.
My advice would be not to take this diagnosis as something that is going to change your life utterly and completely. It is something that is serious, but all you need to do is to take it seriously and introduce a measure of control in all you do, but that deep down your standards of life will be very little changed.
Really to listen to what advice you're given and find out as much as you can about the condition and follow the guidelines.
There's plenty that you can read up on it, and that gives you lots of ideas on how best to sort of deal with it, and and gives you that bit of incentive because you can read the things that go wrong as well if you don't. So it's best to look into it, and just because if you face up to it, you can really deal with it quite well, and as I say, it doesn't really need to affect your life too much.
Do more exercise. If you don't do exercise, do more exercise. Stop eating rubbish like drinking cans of Coke, eating bars of chocolate, eating chocolate biscuits, sweets, and start eating fruit and vegetables and things that are actually good for you.
I would say the most important thing is to speak to someone else who has diabetes, and to also to get as much information as possible about it, because the more you know about it, the more you can control it, and I think that's the key.
Well, my advice is to take it as it is and just face up to it. Don't try to hide it. Don't think it's a terrible, life-shattering thing, because it's not.
Take good note of everything that's said to them and try it and follow it within reason to the letter, because we do all get careless and get a bit sort of jack the lad about it, and there's no mild cases of diabetes. If you've got diabetes, you've got diabetes, and that's it. Whether you're in insulin, tablets or diet, it's a serious illness and it must be treated like that.
Other DVDs in this series are Childhood Diabetes, the No-Nonsense Guide, an educational DVD for those who care for children with type 1 diabetes. Teenage Diabetes, an educational DVD for carers and teenagers with type 1 diabetes. Pregnancy and Diabetes, an educational DVD dealing with early pregnancy in type 1 diabetes and for those considering pregnancy. From Pills to Insulin, an educational DVD for people with type 2 diabetes who are switching from pills to insulin. Type 2 Diabetes, the No-Nonsense Guide, is an educational DVD for everyone who has type 2 diabetes.
The Small Video Company, setting the standards for others to follow.